been a surgical trainee for the past 3 years now, and I've been a doctor for the past 6 years. And by far, the most common question I get is, where do you get your trim? That impeccable fade of yours, where do you get it? And I will never reveal my barber. That is classified information. But the second most common question I get is, do you have a life? Is there such a thing as a work-life balance when you're a surgical trainee or when you're a surgeon? And to answer this question is actually quite difficult because I'm not you, you're not me. We have different priorities in our life. You might hold that balance very differently to where I hold that balance. And so it would be unfair if I just spoke about this from my personal experience. So I looked at the research and I found hundreds of papers which looked at the work-life balance of surgeons of different levels of training, different specialties, and in the UK and in the US and a couple of other places. Now, as a surgical trainee, I didn't have enough time to actually go through this information and dissect it for myself. And I wasn't going to upload a video. But then my friends over at Trainee had a tool for me. They've got an AI-powered tool that can sift through all these research papers and produce succinct summaries. And I found that invaluable for actually producing this video. This tool will be able to dissect an entire research paper and summarize it for you, and it will come up with succinct bullet points that you can then click, and then it sends you to that particular paragraph where it was summarized for. So I'm going to show you how I used it. So the first thing that you do is once you're on the dashboard, you can click into the project and you create a resource. You then drag and drop a PDF into this region here, which downloads the PDF, and then on the side here, literally within seconds, produces a summary of all of the main points here. So when you look at a study, so if this research paper is quite long, so instead of reading it all, I could just click into other specialties, and within seconds it produces a summary. So it says here that pediatric surgeons are the most satisfied. I want to read more, so I click into it, and then it brings me to the paragraph where they got that information from, and I can analyze that in a little bit more detail, and so forth. And where I found it particularly useful was the discussion, which is often a couple of pages long. And what it allows you to do is to have a succinct summary of all these paragraphs. And if there was an area that I wanted to read a bit more about, I can click in and have a read of that particular paragraph. And in doing so, it saves me a huge amount of time. The fact that they're using artificial intelligence to streamline productivity and workflows enables you then to spend more time thinking about the effect of the information rather than collecting that information. There's a link in the description below that will give you a 14-day trial. You'll be able to get 70% off your annual membership for the Pro subscription. But to truly answer this question about whether surgeons have a true work-life balance, we have to think about the surgeon. There are a lot of factors that come to play here. The type of surgeon they are, which field they're in, the seniority of the surgeon. Are they within their training? Are they a qualified consultant? And lastly, we can actually think about the type of work that they do, whether this is purely elective work, whether it's emergency work, whether it's mainly clinic-based. And we'll talk about that in the first part of the video. The second part of the question is looking at this work-life balance. Looking through these research papers and then applying it to my personal case, I feel like a work-life balance is where work doesn't get in the way of you fulfilling your life outside work. So that means attending important events, important family and friend events, having regular hobbies, having the ability to interact with your mates and your family outside work. And in doing so, you can avoid burnout. So with that out of the way, let's talk about the first part of the video, which is the surgical aspect of having a quality of life. So as you know, there are various different specialties within surgery, and the Royal College of Surgeons recognises something like 10 different specialties, including cardiothoracics, neurosurgery, general surgery, oral and maxillofacial, otolaryngology, paediatric surgery, plastics, trauma orthopedics, urology, and vascular surgery. And within those specialties, you have different subspecialties. So let's take otolaryngology, for example. You have otology, rhinology, head and neck surgery, airway surgery, pediatric surgery, audiovestibular medicine, and the demands of that subspecialty can be varied dramatically, even within the same specialty, with regards to the amount of elective work you do, with the amount of emergency work you do, and with the different clinics that you might run. So very quickly you start realizing that even the subspecialties can be completely different in the actual commitment and the workload that can be produced from a work perspective. The second factor within a work perspective is the type of centre that you work in. Certain people will work in district general hospitals, which are smaller hospitals that will likely have smaller number of volume and reduced complexity of cases. Others will work in large academic centres in a big city that will see 10 times the number of a smaller hospital with a very high complex workload. Now, I've worked in both types of hospitals and they both come with different challenges. Within an academic centre, within a big large tertiary centre, the complexity that you have on a day-to-day basis is much harder, and that comes with higher stress burden. But it also comes with higher satisfaction and reward, having helped someone that has been referred to you by a colleague or someone who in their centre didn't have the facilities or the setup or the intensive care to actually help this particular patient. Another factor is to do with the bottlenecks that exist in surgery. It's a very competitive specialty, and certain specialties are even more competitive than others. There are certain bottlenecks at different levels, and that can lead to a great amount of dissatisfaction if you're doing service provision roles and the type of work that you're doing isn't as rewarding as when you're operating and seeing patients in clinic and progressing along the way. So a lot of these research papers talked about how at different levels in your career, the levels of satisfaction were varied based on whether you were progressing and whether you were in a service provision role versus a training role. I've certainly noticed that my satisfaction at work has changed dramatically from SHO to registrar. In certain specialties, it's very difficult to actually make that step, and a lot of people have to take multiple years out to apply and then reapply, and that has the risk of making people disillusioned and dissatisfied with their rate of progression. Similarly, another bottleneck that exists is the movement from registrar training into a consultant job. Often by the end of your registrar years, you will choose a subspecialty that you want to specialise in, and the need for a particular subspecialty might be very varied based on the time that you're applying and also the location. If you want to do rhinology, there may be enough rhinology consultants in London, so you're forced to leave London, or you're forced to wait around for a consultant job. Now, certain specialties are very good at having enough workload to house new consultants on a yearly basis, but sometimes the training program produces more trainees than there are consultant jobs, so what you're left with is a lot of people waiting for consultant positions. Now, this is probably more common with the more niche subspecialties such as neurosurgery, which is only performed in large trauma centres or large tertiary units, and so the amount of neurosurgery consultants needed in London is actually far less than the amount of trauma orthopaedic surgeons that are needed in London. As a result, you get a lot of registrars who've completed their training who are waiting for a consultant post to be opened in London or are forced to leave London. So they're the surgical factors that might influence whether someone has a work-life balance. And I'll talk about my personal experience towards the end of the video, but before that, let's progress on to the second part of the video, which is that of having a life outside medicine and whether that's possible. Certainly towards the start of your career, when you're a junior surgical trainee as an SHO, you'll be sitting exams, you'll be doing research projects, you'll be doing audits, you'll be picking up extra shifts, and you'll be attending theatre on your days off to try get that, that tiny bit of surgical training in hopes of being a good registrar and being a good applicant for your registrar training. And on top of that, you'll be covering the emergency service, so you'll be needed in hospital 24/7 as a body of SHOs, and if there's anyone unwell, you may be asked to cover. And in that time, with that rota that you're given of doing night shifts, weekends, and long days and short days and clerking shifts, it can be very difficult to actually have commitments or regular commitments outside work. There are certainly people that I know that have done it, but in the way of having a regular hobby, I found that extremely difficult to actually manage alongside all of the other commitments that you had. The other aspect is the ability or flexibility to attend family or friend events at reasonable notice. Now, within most hospitals that I've worked in, it was down to you as the surgical trainee to find your own cover. So if you needed to go to a particular event, you would have to swap shifts with your colleagues to ensure that there was a 24-hour cover to the service and that it wasn't disrupted with you going on leave. Now, whether this is sort of the done thing or whether this was enforced by the rota coordinator, was very varied within different hospitals that I've worked in. And within the research that I looked through, there's a lot of reports of surgical trainees being unable to attend big family events or weddings or friend gatherings because of the inability to provide a swap, or being able to swap out of a night shift, or something that's actually quite difficult to swap because it requires a lot of coordination. The fourth thing that's actually been introduced more recently is this ability to work from home. Now, this is completely new to most people, and COVID really highlighted the importance of well-being and flexibility. And within a career of surgery, it is impossible to work from home. Even, your administrative tasks, which you get time allocated for, you're to attend the hospital, so you are on site in case there's an emergency that requires more than one person, or there needs to be cover for some sort. But for the most part, you're going to be on site 5 days a week at least, and with the emergency burden on top of that. So all those things that I've spoken about are mainly most relevant to junior surgical trainees to SHOs. As you move through the ranks, your ability to have regular commitments and to plan ahead improves vastly, especially in specialties where you don't do on-site night shifts, where you can be at home and have a night shift, because it's much easier for your colleagues to cover you from the comfort of their own home rather than having to cancel their plans, go into hospital and do the shift from there. When you become a registrar, your life becomes far more organised. Week on week, your schedule is very similar. There's very few fluctuations in your clinic or theatre days. And moving from registrar to consultant, your ability to have more of a hold over your work-life balance and the ability to actually plan your life in advance becomes a lot easier. So I've certainly found that as a registrar, you have better grip over your schedule and your ability to plan ahead if you're organised enough, which often I'm not. So there's no doubt that when you become a consultant, you have good work-life balance, or most consultants have a good work-life balance, unless you're doing regular cancer work in a busy NHS centre where you're going to be on the go on a regular basis. But the important bit here is the timing. You'll be an SHO for your, early to late 20s. You'll probably be a registrar in your late 20s, moving to probably the majority of your 30s. You'll be a consultant probably in the end of your 30s into your 40s. And so to not have that flexibility in how you work or when you work, or whether you can commit to certain things in what it might be the prime of your life, is a huge sacrifice. And it was a big point of debate within the research papers that I was reading. So where's the conclusion? What do we think? I personally think that as an SHO, I had very little work-life balance. The vast majority of my time I had off, I was abroad. All the other times I was doing clinical work or academic work or something to advance my career and revising for exams. Now, that was only 3 years of my life, but I did have some escape from that conveyor belt, from that routine. Now that I've started my registrar training within a very happy, comfortable specialty, albeit very competitive to get into, but I have felt that my ability to have a work-life balance has improved dramatically. I regularly go to the gym, I regularly see my friends, I have the opportunity to do regular hobbies, I have the opportunity to go on holidays and actually plan family events and friend events, and I haven't missed a friend's wedding since. So in conclusion, I do feel that you can have a work-life balance within a surgical specialty, but there are two main factors at play. Number one, the specialty that you choose. Number two, how senior you are. I do feel that everyone does have to sacrifice their life as an SHO. Whether that's right or wrong is up for debate, but I do feel that the vast majority of people that I know that managed to secure a competitive specialty in a competitive city did have to pause their life to some degree as an SHO. And in my eyes, it's worth it if you are able to set yourself up for 6 years of registrar training in the place that you want to be, and then you can restart your life. Looking back at it, it was between the ages of 25 and 28, which are quite important years for me, but I don't regret it. And I'm having a huge amount of fun and learning loads, and registrar training has lived up to all of my expectations. So I would recommend. But thank you once again for Genie for sponsoring this video, and we will see you next week for another very exciting video.
Running out of patience, baby, these days sort of drive me crazy, oh,